You know, the VA today is a nightmare, just a nightmare to deal through, to try and get any service out of. You know, TBI victims wait, when they come home, they wait 6 months for their first check. Again, please, sir.
Yeah.
Please.
Yeah, I understand that the benefit recovery period, the time it takes to get benefits paid, has been lengthened dramatically under this administration. And I've got a son who works in healthcare. He's a doctor. He's in residency. And he works at the VA hospital sometimes as part of his training. Then he works in regular hospitals. And he says, you know, Dad, the VA hospital isn't getting, you know, the same level of care and attention that sometimes exists in the private hospitals and in the public hospitals. We need to recognize that those who serve this country in our uniform have a special place in our hearts, and we have to care for them. And the American people feel that. No question in my mind, but that they recognize that we have a huge obligation to those who served our country. And I certainly feel that way. And one of the things I can't understand, right now the president's cutting back on spending, and that's something that has to happen. But he's only cutting back on the military. He's going after Tricare, saying, okay, we're gonna raise the co-pays, we're gonna cut the benefits. Why is it we go after military families? Why isn't he going after government workers that are represented by the big government unions? I think I know the answer. My view is we care for our soldiers. We care for our soldiers and their families first. That's our responsibility as a nation.
Regulations, regulations, regulations.
Amen.
And right now, one of the major one that's killing us, sir, is health care. On Wednesday, our employees saw their new health care plan, 2012. The deductible went from $2,250 to $6,000. People were mad, tears were visible. Medical savings plans that mothers depend on were gutted. You say you're going to eliminate Obamacare, but replace it with what?
Well, you mentioned, you're talking about medical savings, you meant flexible spending accounts.
Exactly
yeah,
right.
FSAs. FSAs are a great program, and you're right, they were gutted. The Obama administration put a cap on them. So here, it's all the way President Obama focuses on things. It's always about him micromanaging everything, dictating to people what they can. He doesn't want people to have flexible spending accounts for them to meet their own health care needs. He wants to limit that and then shift the responsibility to government to tell you what health care plan everybody has to have. That's the fundamental shift that we're seeing already starting to take place as Obamacare slowly is implemented, and eventually we will have not only no flexible spending accounts, or very limited ones, but mandated benefits on everybody. And of course, your $6,000 plan,
You can't afford it.
yeah, well, it's right, unless you have something that I've worked on, and actually, you know, we're here in Ohio, and Governor Kasich and I were the authors of health savings accounts. Right. And health savings accounts is an idea of higher deductible, but having the premium savings of the higher deductible go to the employee in these accounts to help them meet the ordinary necessary expenses. Health savings accounts are growing in this country. They're growing in popularity. We need to expand them greatly. We need to have transparency in pricing. We have to have transparency in the idea with respect to the quality of the provider that's providing this care. In other words, we need to do what you do, which is to go out and compete, go out and have 300 million consumers in America. That will drive down healthcare costs, not government regulation.